Hello guys, welcome back to Dental Info. So we have received many queries regarding the side effects of COVID-19 vaccine, doubts on whether everyone has the same experience or do different people experience different symptoms and much more. So to get your queries answered, do watch the video till the very end. And please do not forget to subscribe to our channel. So as we all know that COVID-19 infection, which started in the year 2019, made a quick rise worldwide from January 2020. Scientists had first identified a human coronavirus in the year 1965, which caused a common cold. Said to have originated in bats, the coronavirus has led to severe acute respiratory syndrome. The rise of the pandemic made everyone call the year 2019 as the COVID year. The COVID pandemic was the only top news on all the channels worldwide. What began as a mysterious pneumonia-like illness in Wuhan, China, has spread 2 to 3 people at a time across 216 countries and territories. Coronavirus has quickly crossed the borders of many countries. Countries such as Japan, Thailand, Singapore, Taiwan, and South Korea were among the first countries involved due to their proximity to China. Japan was one of the countries most affected by the COVID-19 virus. To date, according to WHO, there have been 132 million active cases of COVID-19 virus worldwide with around 3 million deaths. The world has been fighting against the infection successfully, resulting in a recovery of 16 million people. But it is noteworthy that the deaths from this disease continue to rise even today. The pandemic COVID-19 has severely affected the worldwide public health, culture, economy, and human social behavior. In February 2020, the WHO said it did not expect a vaccine against the causative virus to become available in less than 18 months. On 2nd December 2020, the United Kingdom's Medicine and Healthcare Products Regulatory Agency and approval for the Pfizer BioNTech vaccine, becoming the first country to approve this vaccine and the first country in the Western world to approve the use of any COVID-19 vaccine. It was then later that the grant was approved for the Moderna vaccine. In India, Covishield and Covaxin have been inoculated to the Indian masses on a large scale. Bharat Biotech, the Covaxin vaccine's manufacturer, is said to have an efficacy rate of 81%. Oxford AstraZeneca vaccine, known as Covishield in India, has also been used. India launched its vaccine drive, the world's largest inoculation effort, in early January 2021. It has vaccinated nearly 30 million people so far. Healthcare and frontline workers were given priority in the first phase. People over 45 are now getting vaccinated. Vaccines reduce risk of getting a disease by working with your body's natural defense to build protection. When you get a vaccine, your immune system responds to it by producing antibodies. Antibodies are proteins produced naturally by the immune system to fight the disease. The body remembers the disease and how to fight it. If you are then exposed to the germ in the future, your immune system can quickly destroy it before you become unwell. The vaccine is therefore a safe and clever way to produce an immune response in the body without causing illness. Our immune systems are designed to remember. Once exposed to one or more doses of a vaccine, we typically remain protected against the disease for years, decades, or even a lifetime. You may have some side effects which are normal signs that your body is building protection. These side effects may affect your ability to do daily activities. But they should go away in a few days. Some people may have absolutely no side effects. Some of the most common side effects include tiredness, headache, muscle pain, chills, fever, and nausea. There may be pain, redness, and swelling on the arm where you got the shot. As discussed previously, vaccines work by building a natural defense against the virus. These vaccines contain either virus replicas or less virulent pathogens, known as live attenuated vaccines, or dead viruses, which are also known as inactivated vaccines. The Covishield vaccine is made from a weakened version of a common cold virus known as adenovirus from chimpanzees. It has been modified to look more like coronavirus, although it can't cause illness. When the vaccine is injected into a patient, it prompts the immune system to start making antibodies and primes it to attack any coronavirus infection. The jab is administered in 2 doses, given between 4 and 12 weeks apart. Covaxin is an inactivated vaccine, which means that it is made up of killed coronaviruses, making it safe to be injected into the body. Bharat Biotech used a sample of the coronavirus isolated by India's National Institute of Virology. When administered, immune cells can still recognize the dead virus, prompting the immune system to make antibodies against the pandemic virus. The 2 doses are given 4 weeks apart. There are many queries related to the chances of developing serious side effects. So, let me tell you that the chance of developing any serious side effect is equal to 0.09 to 0.4% per 10,000 doses, which is a negligible amount. And these side effects may be in the form of yellow fever or measles or flu. In case of occurrence of any serious side effect, it will take place in few minutes to an hour. So all the vaccination centers make sure that after the jab, you are kept under observation for some time. The signs of serious side effects include difficulty in breathing, face and throat swelling, dizziness and weakness, tachycardia and skin rash. The most common side effects mentioned previously are very common among people, and there are few tips which help us get through those symptoms comfortably. The tips include medications such as ibuprofen, acetaminophen, aspirin, or antihistamines to relieve post-vaccination side effects if you have no other medical reasons that prevent you from taking these medications normally. You can also talk to your doctor about taking these over-the-counter medicines. Intake of fluids should also be increased. You can rest lightly for a few days post-vaccination to make yourself more comfortable. Applying a clean, cool, wet washcloth over the area can also prove useful. Rest and relaxation for 1 to 2 days is a must irrespective of the side effects. This will help you jump back on work after a few days after the vaccination. Now there is one more query, or can be called a myth, saying that COVID-19 vaccine can make you sick of COVID-19. Well, the answer to this is a big no. None of the authorized and recommended vaccines contain the live virus that causes COVID-19. This means that a COVID-19 vaccine cannot make you sick with COVID-19. There are several different types of vaccines which have already been developed or are in the process of development. All of them teach our immune systems how to recognize and fight the virus that causes COVID-19. Sometimes this process can cause symptoms such as fever. These symptoms are absolutely normal and are a sign that the body is building protection against the virus that causes COVID-19. It typically takes a few weeks for the body to build immunity, that is protection against the virus that causes COVID-19. This means it's possible a person could be infected with the virus that causes COVID-19 just before or just after vaccination and still get sick. This is because the vaccine has not had enough time to provide protection. Vaccines are a critical new tool in the battle against COVID-19, and it is usually encouraging to see so many vaccines proving successful and going into development. Working as quickly as they can, scientists from across the world are collaborating and innovating to bring us tests, treatments and vaccines that will collectively save lives and end this pandemic. Safe and effective vaccines will be a game changer, but for the foreseeable future, we must continue wearing masks, physically distancing and avoiding crowds. Being vaccinated does not mean that we can throw caution to the wind and put ourselves and others at risk, particularly because it is still not clear the degree to which the vaccines can protect not only against disease but also against infection and transmission.